everyone, welcome to our program Doctor, and today my topic is diabetes mellitus. Diabetes mellitus is a group of metabolic diseases in which a person has high blood sugar either because the pancreas do not produce enough insulin or because cells do not respond to the insulin that is produced. This high blood sugar produces classical symptoms of polyuria, that is frequent urination, polydipsia, increased thirst, and polyphagia, that is increased hunger. And there are three main types of diabetes mellitus: type 1, type 2, and gestational diabetes. Coming to the type 1 diabetes mellitus, and this is also known as insulin dependent diabetes or juvenile diabetes, and this results from the body's failure to produce insulin and currently requires the person to inject insulin, and this is characterized by the loss of insulin producing beta cells of the islets of the Langerhans of the pancreas, and which leads to the insulin deficiency. The majority of type 1 diabetes mellitus is the immune mediated, in which beta cell loss is the T cell mediated autoimmune attack. And type 1 diabetes, also known as unstable or labile diabetes, because there is a dramatic and recurrent swings in the glucose levels, often occurring for no apparent reason, and there is no known preventive measure against the type 1 diabetes. Coming to the type 2 diabetes mellitus, and this is also called as adult onset diabetes, and this type of the diabetes due to insulin resistance, and this is a condition in which cells fail to use the insulin properly and sometimes combined with an absolute insulin deficiency, but the specific defects are not known. In the early stage of type 2 diabetes, the predominant abnormality is reduced insulin sensitivity. At this stage, hyperglycemia can be reversed by the variety of measures and medications that improve insulin sensitivity or reduce glucose production by the liver. Next, coming to the gestational diabetes, it resembles type 2 diabetes in several aspects, involving a combination of relatively inadequate insulin secretion and responsiveness, and it occurs about 2 to 5% of all pregnancies and may improve or disappear after pregnancy. And gestational diabetes is fully treatable but requires careful medical supervision throughout the pregnancy. About 20 to 50% of affected women may develop type 2 diabetes later in life, and untreated gestational diabetes can damage the health of the fetus or mother, and risks to the baby in untreated gestational diabetes. And there is macrosomia, that is high birth weight, and congenital cardiac and central nervous system anomalies, skeletal muscle malformations, and increased fetal insulin may inhibit the fetal surfactant production, which may lead to respiratory distress syndrome. And hyperbilirubinemia may occur due to red blood cell destruction. In severe cases, perinatal death may occur, and labor induction may be indicated with decreased placental function, and a cesarean section may be performed if there is a marked fetal distress or an increased risk of injury associated with macrosomia, such as shoulder dystocia. And other types of diabetes, first one is pre-diabetes, and this is a condition in which a person's fasting blood sugar is higher than normal but not high enough for the diagnosis of type 2 diabetes. And many people destined to develop type 2 diabetes spend many years in this pre-diabetic stage. And next one is latent autoimmune diabetes of adults, and this is a condition in which type 1 diabetes may develop in adults. And as I said, usually in adults type 2 diabetes is common, but latent autoimmune diabetes is also seen in adults. And third one is congenital diabetes. This is due to genetic defects of the insulin secretion. And fourth one is steroid diabetes. This is induced by the high doses of glucocorticoids. And finally, any disease that can cause severe damage to the pancreas may lead to diabetes. For example, cystic fibrosis, chronic pancreatitis, etc. Next, coming to the signs and symptoms of diabetes. The classical symptoms may develop in untreated diabetes are loss of weight, polyuria, polydipsia, and polyphagia. Then symptoms may develop rapidly within weeks or months in type 1 diabetes and may develop slowly or even absent in case of type 2 diabetes. And prolonged high blood glucose levels can cause absorption of the glucose by the lens of the eye, which causes the blurring of the vision. And a number of skin rashes may develop in the diabetes are collectively known as diabetic dermatomes. And I want to discuss complications of the diabetes, pathophysiology, and also management in the next episode. And I hope you enjoy this program. Keep watching our programs. We will meet in the next episode. Till then, take care.